So talking about inattention and misdirection, we're going to switch subject to healthcare reform and how to fix the system. And so I'd like to welcome Dr. Stanley Feld to tell us about that. Thank you.
It's very important that I follow this lecture on illusions, and I have to give it to Larry to pick that out, because we've been living an illusion about medicine for 50 years. Now, in order to understand the audience, I got to know a couple of things. How many people are physicians here? Good. And how many people are pure scientists? Great. How many people are businessmen? Hey, oh, that's good. And how many people think that the healthcare system needs to be repaired? Better than ever. Okay? And how many people think that Obamacare is going to fix the healthcare system? That's even better than I thought, because of being in Boulder. If I was in Dallas, Texas, everybody would put their hands behind their back. But what I want to do is I want you to think about this, not in the context of what's going on, but just kind of absorb what I want to point out. First thing is I want to tell you that I think I figured out how to repair the healthcare system. And I figured this out when I went into practice in 1970, and I knew that it was broken. I'm not going to go through the history of what happened in any detail, but I'll just give you kind of glimpses of it. How many people were born before 1970? Better yet, because none of you have ever experienced this. And this is a Norman, or you experienced variations of this, but you didn't really experience this. This is the Norman Rockwell picture that was about the business model of medicine before 1965. And what it was is it was the physician, and the physician saw the whole family and paid very close attention to what the mother was saying usually. The kid was sick, the father was looking over, and the older kid was in the corner. Now, I experienced this, and I experienced this when I was a kid. 6th grade, I'm a lefty. And when I was born at that time, being a lefty was sinister. Left is sinister, correct? And so my 1st grade teacher made me write with my right hand, not my left hand. And my mother was hysterical when they brought her up, and I might get a little emotional about this. Brought her to the 1st grade teacher, and the principal said, "There's something bad wrong with your kid. He can't talk, he can't this, he can't that." And my mother brought me over to Dr. Schultz right away, and Dr. Schultz in his house brought me into a room similar to this and listened to my mother rant and rave. And then he asked me, "Kid, what's wrong?" "I don't know. I want to write with this hand," and she makes me write with that hand. So he makes me write a little thing with my right hand. And he said, "I know what's wrong with you." And he put it up to the mirror, and it was correct. Now, there are two lessons there. One, the doctor listened to the patient. How many people in this room have been to a physician in the last couple of years? And how many people have felt that their doctor really listened to them? Less than half. That's great. Well, it turns out that the doctor can't listen to the patient anymore because he's pressured by too many things. Well, what happened in the... what did I do here? Did I get all these things up there? The advantages of it then was that it was democratic. And if the patient went to the doctor's office and they couldn't afford to pay, they brought a chicken or dinner. And if they could pay, they paid with dinner. Now, it was personal. The doctor knew us. It was efficient. It was adequate. And again, it was, but he didn't know very much. He just guessed about things, and we didn't live very long. And what we did was we moved into a technological era, and by moving into this technological era, things changed. A lot of things influenced the change, but the business model of that 1945 patient has to change. And it has to change not necessarily to a marketplace model, but marketplace models, in my view, are most efficient. So we're going to talk a little bit about the business of medicine, because a lot of people understand that the business of medicine is what's distorted and not necessarily the doctor-patient relationship. The doctor-patient relationship is almost destroyed. And what I described before was that doctor relating to the patient. Now, what should change? Obviously, it's the business model. And how should we change it? By developing a system. Now, some people say, we don't have a system in medicine. Well, we do have a system. We have a system that the components of which every stakeholder, and the most important stakeholder is the patient and the physician. All the rest of the people are secondary. Hospital is secondary, government is secondary, and the insurance companies are secondary. So the principal stakeholders are the patient and the physician. And they're all misaligned right now. Everybody is doing their thing, and nothing is coordinated. And we have this world of technology that's there. So the proposal is that we have to change from all of these secondary stakeholders being in charge, like the hospital buying doctor practices, like the insurance companies controlling the bills, like the insurance companies servicing the government. There's no Medicare in that sense. The Medicare, they're the conduit that gets you insurance, but the insurance company are the people who pay the bills. And they can fidget with all of the financials. So it has to be patient-oriented. And all the secondary stakeholders were just, now this is what the doctor had in 1965. He didn't have any tools. He just had this stuff. But what he had is he had the ability to listen to the patient. And the patient makes the diagnosis by telling you the story 85% of the time. Now, at any emergency room in the country, you might say, what hurts? And they say, well, I just banged my head, and you get an MRI. But if you take a history and do a couple of simple things, you could know you wouldn't have to do an MRI. Or if something hurts in your belly, they could tell, if they really listen to the evolution of that disease, what's going on. Now, so we're faced with a giant chiasm right now, a chasm. And that giant chasm is the patient goes to the doctor, and all these things happen, and there's a split there. And why did that occur? That occurred because of all this stuff that happened since 1965. Everything failed. As soon as the government in 1980 ran out of money, or started to run out of money, they started to reduce the cost. So what happened is it shifted to the private sector, and that got worse, and then you get in this terrible spiral that ends up in this. And now we have Obamacare, which was a struggle to get passed, and it did, but it ended up with this business model. What are the barriers in this business model? The patient has no control over anything. And you remember, it's a doctor-patient relationship, and the patient can tell the doctor. When we heard this brilliant nutrition talk, I mean, people take stuff, and it's a $35 billion business right now. They take stuff to fix themselves, and they don't have the faintest idea of what they're taking. Wouldn't it be wonderful if that could all be developed so that you knew what you were taking? Now, so the patient has no control over any of their medical decisions, and the patient has no control over their health care dollars. They go in there, they don't know what they're spending. and it's impossible to find out because there's no transparency, okay? The patient doesn't have to be responsible for their treatment because nowadays it's not true, but they used to have first dollar coverage. So why should I take care of myself? I get sick, I go to a doctor, I get fixed, and I'm all better. And he doesn't have to talk to me. I don't have to tell him anything because he's not going to dig in on anything, and people get sicker, okay? Now, chronic disease, and I don't know, does anybody have a chronic disease in this place right now? Okay, anybody have diabetes? Well, I know a lot about diabetes because I was a diabetes doctor. And you know who should be taking care of the diabetes? The patient. As a doctor, what we did was we set up a diabetes education center. And this diabetes education center, the basic premise was to make the patient the professor of their disease and give them their ability to change their medication. And the physician, me, I was the third base coach to tell them whether to go home or not. That's right. Now, think of it. How many times could you not end up in the emergency room if that was the case? Think about asthma. We know how to stop an acute asthma attack. If somebody was a professor of asthma, we'd save millions and millions and millions of dollars taking care of that asthmatic attack. So education is primary to this business model. The problem is that it has to be an extension of the physician's care because of the nobility of that doctor-patient relationship. And what's happening today is doctors are being turned into commodities and patients are being turned into commodities that end up being a financial advantage to secondary stakeholders. And the secondary stakeholders have figured this out because they make it more and more and more and more complicated. You end up throwing more and more, and I'll tell you about actuaries in a little while. Anybody in the insurance business here? Because if they are, I won't tell you about actuaries because they might shoot me. But anyway, but I'm trying to make you aware. Now, let me tell you why I'm trying to make you aware. Because the government isn't going to fix it for us. The insurance company isn't going to fix it for us. Physicians are too timid to fix it for us, and they're not organized. So who has to fix it for us? Us. Now, if you're 35, 40 years, 45 years old, what you have is you're so busy doing your work, you don't have time to fix it for us. So I write a blog, and I had that up there. And what I'm doing is I'm forming a posse. So one guy of people that are going to fix it for us before we die. And one guy wrote to me, he said, you know what we ought to do, and have a bunch of physicians. He said, we ought to form an organization called the American Association of Retired Physicians who's dedicated to fix the healthcare system. He wrote me I said, it's too long a title. But the point is, people who have no money in the game are the people who are going to be most affected, i.e., all the patients of the future, have to make all the other vested interests that are making a fortune out of this stop. And it's the easy way to do it is to say, oh, well, give it free. Well, I have to tell you a funny story about giving it free. I started a metabolic unit at a hospital as chief of endocrinology, and I couldn't get it done, and I went through all the committees that you go through a bureaucracy, and the last guy there is the CEO, and he built the hospital, and they gave me 2 rooms and 4 beds. And he calls me and he says, look this is my hospital, and nobody's going to knock a wall between one room and another room. And that's what happens. You just hit too much bureaucracy because things go. And I talked him into putting a door between it, and then nobody ever walked through that door. So it was a kind of mistake. Now, this is what happens with the barrier between physicians and patients. It's tort reform. If you miss a diagnosis, you could get sued, depending on the state you're in. In Pennsylvania, it's the worst. And it costs, by some good studies, $750 billion a year on excess testing. Now, we get the headline or the soundbite, excess testing is no good. Well, of course it's no good. You don't need it. If you took a history from a patient, you wouldn't send them for a CAT scan as soon as they walk through the emergency room door. But if you didn't take it and the patient got, then you'd be in trouble and you'd be sued, and that's not fun. Now, what's happening is as we have, and I wrote guidelines, as we have more and more guidelines and as we make more and more algorithms, the physician can't use his judgment. And medicine is not a business, and it's been turned into a business, and it's to the disadvantage not only to the physician, but the disadvantage to the patient, and that chasm gets wider and wider and wider. And there's a constant lowering of physician reimbursement. So what happens? He has to see more patients, and as he sees more patients, he talks to you less, he does more tests, and things get worse. And the treatment is driven by government regulations. So right now, you could get a pacemaker, but 3 days from now, you might not be able to get a pacemaker because 10 cardiologists or 50 cardiologists are deciding, I'm not doing a pacemaker on somebody that's 77 years old. Now, these are the business models, and this is the barriers that I just described to you, and this is what happens. You go to the doctor, you have something wrong with you, you have something wrong with you, so he sends you here, he sends you there, he sends you there, he sends you there, and you have all this stuff. Anybody ever experienced this? That's not too good. And then what happens is when they give you stuff and send you stuff, you get other stuff happening, which you go through the circle again. So it has to stop, and it stops by the doctor-patient relationship. And I'm going to relate this to how technology and our advance can really help this. So this is a stupid cartoon. It says you run in circles, and hope to God they don't kill you before you get better. And it's all fragmented, and it's going to fall down. There's no question it's going to fall down because the government's running out of money. Everybody's telling the government, you know, if you have an entitlement, you want to give it up? You know, like Larry's so sweet to have us come back and back and back. You think I want to give that up? You're nuts. If I have food stamps, do you think I want to give them up and go out and plant a garden in my backyard and eat all the stuff that I'm supposed to eat? Nah, it's easy to get the food stamps. Okay? So what happens here is that what Obamacare has done, and this is the illusion, is he's supposed to help us and make it affordable. How many people have heard that insurance is going up 25%? Everybody, right? It's going to be affordable. How many lower deductions you have? Now, this is not just for people over 65. This is for people across the board. There was an article reported this week that if you're 25 to 35, your insurance is going up 55%. Now, somebody told me yesterday that they had to pay for insurance for their kid and it cost them a fortune. Well, if I'm a kid that's 26 years old and I have nothing at risk, you think I'm going to pay a ton of money for insurance? Especially when he tells me if I get sick, I can buy insurance then. Okay? So it's going to total collapse, and his goal is to get all the patients to join. And that's the mandate, and that's the Supreme Court and stuff. But the doctor's pay will get cut, so there are going to be fewer doctors around. The fewer doctors around will decrease the time you can spend with you, and the fewer doctors in labs that will accept Medicaid, the government is going to have more control over the patient. And it'll be less democratic. The rich will figure out how to get taken care of, and the poor will be crushed. Taxes will escalate, insurance costs will increase, and the complexity of the regulations are incredible, especially when you don't know where they come from and how much you paid for and what it cost until you get the bill. Now, this week, Medicare just published, and this was, I don't know whether it's good or bad, but what they did was they just published all the costs for several diseases retail cost or the bill that the hospital sent to Medicare and how much they paid. And Medicare paid somewhere between 40 and 20% of whatever the bill was. Now, if you didn't have an insurance and you went to the hospital, you know what you'd pay? 100%. So that's insane. That is one regulation that just busts apart and you forget about repairing the healthcare system. Because if you save 50% of the healthcare dollars, then you'd be fine. Now let's talk about diabetes for a minute. Well, let me just say this. So it's going to be more wasteful overhead, and everybody's going to try to protect themselves, and nobody gets cured. Now let's talk about diabetes. If you take cost for diabetes, 80% of the healthcare costs for diabetes, and if the diabetic who raised their hand over there just thinks about how much money they spent to the doctor, and let's say they were well and they didn't have to go to a hospital and they don't have any complications, with only 20% of the healthcare dollar for diabetes is spent on the care of diabetes, and 80% is spent on it. Now, you know what 80% is? 80% is about $200 billion of the bill. And that could be saved, 50% of that bill could be saved if people became professors of their disease. So these are the things that are happening. You're not going to be able to have a choice. You're going to have rationing of health care, and that's happening already. Okay? You're going to be paying more. You're going to be restricting access to care. Now, most people haven't felt that yet, but you're going to feel that in 2014 because the regulations are intact. Now, the way they're going to fix it is they're going to say we're going to do accountable care organizations. And accountable care organizations, how many people are aware of what goes on in an accountable care organization? Well, let me tell you the problem. The problem is, historically in America, doctors and hospitals don't trust each other. And hospitals have forever taken advantage of doctors. The hospitals take advantage of patients. So when the patient leaves the hospital and they get their bill, they're mad at the doctor because you're not going to be mad at your bureaucracy. How many people read Mann's Castle, Thomas Mann's Castle? Poor guy tried to pay his bill and nobody would give him an answer because nobody has any responsibility. Who made that bill? So there has to be a nidus in this new business model of responsibility. Now, who has to be responsible? The primary stakeholders. And the physician has to be responsible to the doctor, and the patient has to be responsible for their health care. And that's what we're talking about in this $30 billion business. Now, the HCO is going to fail. One of my friends gave a talk a couple of weeks ago and telling how we're going to beat the hospital because we're going to make the hospital our customer, and how we're going to beat the insurance company. And I said, why in the hell would you take risk when the variable is the patient, not you? And the insurance companies haven't figured out how to control risk. And the hospitals haven't controlled risk, so why should you? And eventually, not eventually, it's going to take a short period of time and it's going to fail. What's key to the present business model is that the patient's ignored. And the patient is the most important part of it. Now, I'm not saying this to make you feel good because you're all potential patients. I'm telling you this because that's who should be the one that's being focused on, and they're not. And the medical costs will escalate, people won't be able to afford it, and then you'll have horrible medical care. And that's why it's going to break. So, everybody knows this, right? Knowledge is understanding your mistakes, and wisdom is not making them over and over again. And what do? We do the same, or not we, but our politicians do it. And what do we feel? We feel powerless. But we're not. Because I'll tell you who worries about patients, us, or consumers, us. So it has to be consumer-driven. Politicians worry about us because we vote for them. Doctors worry about us because right now we have a choice. We could go to this one or that one or that one. And if this one does better service, and I had this experience, we did this over and over again, we did this diabetes education center. And so we opened it up to everybody in town, and everybody was sending the patients there. And then all of a sudden, we stopped getting patients. And we stopped getting patients, not from the Diabetes Education Center, but seeing us, because the patients that went to the Diabetes Education Center wanted to see us. So well, that's stupid. So we stopped that. And they had to be referred to us. And the reason for that is we were giving them the service that they needed to control their disease. And that's missing in this. Now, how do you do it? And that's the key to this lecture. You remember this in the publishing system? Publishing companies? And what happened? Apple came along and put them all out of business because he disintermediated the publishing system. What did Amazon, the music publishing? Amazon did the same thing. Now, consumer-driven healthcare is what I'm advocating, is the ideal, with the ideal medical savings account, and I'll explain that in the question period, will disintermediate the healthcare system because you'll be in control of your healthcare dollar and you will be in control of all of your freedom. And there's a bridge. And the direction is this 2020 business model, and what it does, I told you everything was misaligned, what it does is it aligns the patients, the physicians, the government, and the healthcare system. And it's like knocking the dishes off the table, getting rid of all this bureaucracy. I will tell you, I calculated, somebody was saying, well, it should be free. Well, it's almost free because you know what happens? You put $1 down, and the insurance company services your thing. And what they do is they take 60 cents off the dollar. And that's an illusion. Because in Medicare, President Obama says, we're very efficient. We only spend 2.5 cents out of every dollar to administer Medicare. Well, that's baloney. They have a bunch of guys in a room that decides which insurance company is going to administer it. And then that insurance company then takes that 60 cents off the dollar. So how do you do this? Now, this is between the patient and the physician. This is the ideal medical savings account. Now, let me tell you. If you buy insurance, not you, anybody, let's say it's really $15,000, $16,000, $18,000, but let's say it's $12,000. Now, how many people have experienced $15,000, $16,000, $18,000? And how many people are small employees? And it's getting to the point, employers, not too many. It's getting to the point where they can't afford it, the insurance. So they're giving up insurance and paying a penalty or deciding to pay a penalty. 60% of businesses, small businesses, are not going to give people insurance. Now, the reason for that is they can't pay it. And what happens is then you'd have to get your own insurance. And let's say you're 63 years old. How many insurance companies do you think sell to anybody who's 63 years old insurance? 0. So you're 60 years old, you'll be paying more than $15,000 or $18,000 a year. So there's something wrong with it. Well, this in an ideal medical savings account, you give a patient $6,000. Now, some people go to the doctor because they didn't have anything to do that day, or they had a headache. Anybody ever see that? No. Physicians in here ever see that? So they spent it because they had first dollar coverage. Well, here they won't spend it because if you give them what's left of the $6,000, they're going to become wise people, wise buyers. So they have financial incentive, and the physician has financial incentive because he gets collection immediately. Physician sometimes doesn't get collection for 6 to 8 to 10 months, and he doesn't tell you. In fact, if you file wrong under Obamacare, or the patient dropped out of whatever insurance they had under Obamacare, the insurance company withholds payment for 30 days, 60 days, 90 days, and the new regulation is after 90 days, they kick the patient out, and then the doctor has to go collect whatever the bill was. So it gets worse and worse. And it has to be consumer-driven, and you patients have to understand their power. And then the physician, and I mentioned this, would perform for the patient because he wants the patient as a patient. Tort reform I covered. The ideal electronic medical record. Now, I don't know if anybody reads the paper, but doctors are yelling and screaming it's a waste of time. What it is they figured out how to game the system with the electronic medical record. In addition to that, they just cut and paste, and they don't give their opinion, and so you don't learn anything. And things are categorized, so somebody gets data that makes big data out of it, and the big data is meaningless because it's just the same cut and paste that it used to be. Now, if somebody's so smart to do a great electronic medical record, let the government put it in the cloud. Don't charge the doctor $60,000 or $80,000 a guy. I talked to a friend a couple of weeks ago, and he said, I can't stand it. I spend $650,000, and every year I'm spending $25,000 just maintenance fees, and they come in and they knock it down, and I can't work for half a day. Well, if somebody was so smart, they'd put it in the cloud, charge the doctor by the click, just like you charge for Visa and MasterCard and this and that, and the doctors would use it. The patients would use it because the patients really need to have their medical record on them. Now, everybody has a smartphone on them, but the medical record's not available. What I do is I have my medical record on me, and this is, I'll tell you what a catch-22 it is. Here it is. Nothing to it, right? So you go to a hospital, let's say, and I tried this out, and I said, here's my electronic medical record. You want to see my EKG? You want to see my this? Where does this go? This is, you're talking to the girl at the front desk. Well, and it goes. Oh, there's something a little funny about this EKG. They don't have it, They don't have a place to put something funny with the EKG. We better send you for an echo. Well, you just blew whatever you blew. Okay, I'll be finished in 5 minutes. Okay, so you kind of understand. Chronic disease management, and I mentioned if you do chronic disease management, not only will the patient manage themselves and the physician be the coach, but there's going to be better outcomes. You're not going to have complications. You're going to save 80% of the healthcare dollar. The thing that's missing about education right now, we have a world of education out there on the internet. Half of it, well, I don't know if it's half, but some percentage is great, some percentage stinks. If it was an extension of the physician's care, not only on the internet, but in these freestanding places, then the patient who wants to have a relationship with their doctor so that they know that they're safe would be confident that that doctor wanted them to learn that. Now, what the doctor does is he doesn't do such a great job because you come in with a whole bunch of pieces of paper about the internet, and you hold them up and you say, this is my disease, and this is why don't you do this and why don't you do that? And he tells you what a bunch of crap it was. Well, that doesn't help, especially when there's some good enduring information there. So that has to happen. Now, what about the government? The government's in trouble with money, and they want to save money. And the insurance company wants to save money, but they don't want to pass it off to the patient. Well, if it's patient-driven, and the patient picks the insurance company, not only will the government be out of the business, be able to do what they have to do to augment this freestanding thing, but what they'll do is they'll save money. Electronic medical record, better evaluation. Now, you know who should own the electronic medical record? And this is a problem that physicians have, and I'll speak for physicians now. The physician should own it, and the patient should own it, and not the insurance company or the government, because most of the information and the reason, doctors aren't idiots. I'll tell you that. They have pretty good IQs. But what they've done is every piece of information that the government or the insurance company collects from them is used against them. But when you look at the information or the conclusions from the information are inaccurate. And so claims data is nonsense. So people are starting to figure out how to put in claims data so it can't be held against them. And I have a million things to talk about. I mentioned disease management. So this is what it should look like. It should be patient power. There should be tort reform. Should be price transparency. And there should be consumer-driven healthcare with patient responsibility. And you have to give patient responsibility by giving patients financial incentive. And that's the ideal medical savings account. Electronic medical record will not rupture cash flow from physicians' offices. See, the hospitals want to capture the physicians because they know that brick and mortar ain't going to make it anymore. And so it's the intellectual property of the doctor in chronic disease management. Now, this is what happens. Is revenue is going down because it's, we've hit the top, and the costs are going up. So everybody's complaining except the insurance companies. You haven't heard that. You only hear about $25 million here and $100 billion here and this and that. All these executives. I think WellPoint, they published, you can look it up on the web, the first 50 executives make over $5 million a year. And the top makes $25 million. And what do? They come to work in the morning and they have meetings. And then they go have a long lunch. And then they go home. Now, how do you do this? What you do is you do something that not increases the revenue necessarily, but decreases the costs. And all of these things that would align incentives would decrease the cost, including the patient being in control. But you can't do it one at a time. You have to do it conceptually, and. And this is the future. Not the collapsing, but making it transparent, making it simply. Everybody knows. Remember, it's the same things that we talked about before. Providers are enabled and to reward the provider. Now, the advantage is doctors can do more because they're making a decent living now, even though the price is down because they're wasting it all. When they do a CAT scan, they don't get anything for it. The hospital gets it if they send it to the hospital, unless they own a CAT scan. So everybody says, oh, he owns a CAT scan, so he does too many. Well, we did hyperthyroidism, and we treated people who knew costs. I knew how much it cost me to buy the radioactive iodine. I knew how much it cost me in terms of times. I knew how much it cost me in terms of the potential of disease, and I charged the people for what it was. What little did I know that I was charging 1/10 of what the hospital was charging for the same thing that the hospital was making me come to deliver the radioactive iodine to them. So transparencies of costs are very, very important. And personal relationships are very important, so the patient will tell you the truth and have a chance to tell you stuff. The consumer has to be responsible, and they have to get rewarded for it. Now, the family physician, just like my mother took care of 80% of the stuff, they can take care of 90% of stuff, but not enough family practitioners. One family practitioner said, I can't make a living. After my expenses, I'm making $75,000 a year. He said, on the weekends, I drive a taxi. Life expectancy will get longer, knowledge base will grow, and whole diseases eliminated by your research. So why should you knock money out of research indiscriminately and not have some brains about this? So this is what it is. It's going to take this is a journey, but I'm not going to go through the journey. But the fight's right. That was the important part of that slide. See, the fight to have a consumer-driven healthcare system is critical, and the only ones that can do it are you guys. And this is a wheel that changes the whole ecosystem of medicine. And you notice who's in the middle? The patients are in the middle. and the doctor knows the patient, the physician relationship is maintained, and the system will work. So I have time for questions? Okay.
When I met Dr. Feld last night, he said, if you tell people one thing about me, tell them that this is my passion. Well, I think that's one thing that you don't need me to tell you.
I think many of the points you make are useful and are good ideas. The idea of better patient-doctor relationship is totally important. My problem is I don't see how that's precluded from happening through Obamacare or some other system. My question for you is...
Well, is that a question? I'll answer that one first.
Here's the question. Okay, that's part of the question, but the real question is how do you deal with people with pre-existing conditions, and how are you going to assure that people that don't have any responsibility for maybe having a cancer or whatever are going to be able to get help? That's our problem. We've had
Okay,
50
no,
million people
that's not our
insured.
problem. Let me tell you. Let me tell you, that's not our problem. Okay? Because what you have to do is think about it in terms of cost. Not in terms of little details, and I'll cover that little detail in a second. Let me tell you. Cost. If 60 cents out of every dollar is taken out, let's make the math easy, okay? It's 80 cents. It's 2.5 trillion, not 2.6 trillion. So the arithmetic is we're spending 2.6 trillion. If 50 cents comes out of every dollar, we're spending 1.25 trillion. Okay? Now, how many people are train wrecks? Okay? And let's talk about that. If the 80-20 rule holds, 20% the train wrecks, so nothing's wrong with 80%. Okay? Now, those train wrecks we're paying for right now with a 50% overhead, or 60% overhead, really. Okay? So what happened is you reduce the cost. If it was 1.25 trillion, we'd be in great shape. Now, you understand? So the people who are not going to be responsible, not going to care, that are going to be a burden on society, are going to be a burden on society for half the price. Now, the question is, can you change behavior? You can change behavior. You could change behavior with simple little rewards. And that's why I wanted to get into the medical savings account. Because in the medical savings account, if a patient has diabetes, for example, or if they have hypertension, and I'm the expert, right? And I say you should do this and you should do that. And I'll take hypertension because it's a little easier, and I don't bring, easier to comprehend, and then I'll go into diabetes. And it doesn't bring my blood pressure down, and the patient has something at stake here. Because if they get sick and go in the hospital, they're not going to get any part of that $6,000. So they call up and say, the stuff you gave me stinks. Doesn't work. Come on in. Give me your blood pressures. I've been taking them. I've told them that I want them to take them twice a day. So they bring in their blood pressures. Now, wouldn't it be wonderful if they didn't have to bring in their blood pressure? If their machine was attached to their computer, that was attached to the electronic medical record, that was up in the sky, that was all the data the doctor had. Doctor looks at it and says, yeah, your blood pressure, you're right, doesn't work. Let's try this medicine. And so what you have is virtual, you don't have to go in business. You don't have to go to see the doctor all the time. In diabetes, and then he changes medicine. In diabetes, you give them some prescription, and the patient's responsible for, they say, this amount of insulin or this amount of medicine is not working, and they start changing it, right? And they start getting their glycosylated hemoglobin. I told somebody what glycosylated hemoglobin was, because this is how it works. You know how you get vascular disease from diabetes is you pickle your vessels because your blood sugar is high. That's how you make sour pickles, right? Sugar, vinegar, and spices. And you change cucumbers to pickles. So if the patient gets a normal blood sugar, you decrease the complication rate 50%. If you have a $250,000 bill and you decrease the complication rate by 50%, you have a $125 billion bill. And you don't worry about the 20%. You put your money in those 20% and you hope that they follow. And so there's an answer to that. Most American citizens and most consumers don't want to be sick. And what we're doing is we're building all of this great technology, and I heard mind blowers these last day and a half, and perception mind blowers, that people are getting damped on not to bill because we are wasting 50 or 60% of the healthcare dollar on garbage. That's overhead for big salaries for somebody else. Now, it's not that doctors are starving, because doctors are pretty smart. They figure out how to get around the system. If I made a living on seeing 40% of the patients that I'm seeing now, a good living, if I see 100 patients a day rather than, or 20 patients, I saw 20 patients a day before, and now I see 60, I'll make the same living as I did before. And they're paying the same money. And then they'll have the ability, to walk. In some countries, they can't walk. But a lot of people are going to quit. So you have less, workers, and you have less physicians. And this happens in safety net hospitals. Safety net hospitals cutting down. You go to Parkland Hospital, you got an 8-hour wait, which is not good for the health of the patient. So I hope I answered the question. The point is not the individual thing. It's the number of people who are affected.
I'm not sure whether this is going to give you indigestion for lunch or not.
But no, go ahead.
Coming from the land of the frozen queen, can I make a recommendation to my American cousins to think about a fully socialized healthcare system, free at the point of use, available to all, that allows an integration of primary, secondary and tertiary care, academic medicine and clinical services, and delivers a very good healthcare system at approximately half the cost of GDP. Good.
I was hoping to get that question, because I heard so much from people from Britain. First of all, it's very easy to say that everything's great in Britain, whereas they're trying to convert to a system not like ours, hope to God, no, but a system where it's private enterprise. And the reason they're doing that is because the government can't afford all the, and I'll put quotes around, great care. Now, I'm not going to criticize the care, but I remember the enthusiasm, because I was sent over there, the enthusiasm of the troops, the physicians, in some of the hospitals, the smaller hospitals and the bigger hospitals. And I remember the professors working in the private sector. This was at the time that there was more and more private insurance, because people didn't want to be treated as cattle. Now, if you go through a couple of generations of being treated as cattle, you kind of get used to being treated as cattle. Now, do some people, or do some places do really good work? Yeah, but I think they could probably, at the rate that they're paying money, if they increased the flow through to the system, they could decrease the money by half. And we as a country, or that they spend. So we as a country are wasting at least 50%, and it doesn't bother us. When it got up here, it started to bother us. And a lot of people, don't care. And as we get more and more regulation, it's going to be more. Now, why did it take 45 years for people to start squeaking in, about having a hip in 6 months, taking 6 months for a hip versus taking 4 days? Because generations of people got used to it. We're used to getting a hip in 4 days. Or we're used to getting a knee in 2 days or 3 days. And it's going to take, we're not going to tolerate it. That's the difference. It's a difference in conditioning. I mean, what it is, it's illusions. Yep.
Would suggest that we continue this conversation over lunch, which is
Well,
So thank you, Stanley, and thanks for all this morning's speakers.